My name is Representative Tom Murt, and we're here to recognize May as Dementia Awareness Month in the Commonwealth of Pennsylvania. And we also have my constituent, one of my constituents with us today, Ross Schriftman, who has written and produced a movie about a very personal situation with him. His mother had dementia, and Ross is going to talk about his mom and the sacrifice that his family and the struggles that they've had. But these experiences, of course, are very consistent across the Commonwealth of Pennsylvania for many families that struggle with lovingly caring for a family member with dementia. We also have Kevin Jamieson, who will talk to us this afternoon. Kevin is the executive director of the Dementia Society of America, which is based in Bucks County, not too far from my district, and Kevin's going to talk to us as well. And I just want to make some remarks before I ask Ross to please come forward. Ross and Kevin, could you join me? While it's mostly associated with older adults, dementia affects 50 million people worldwide, some younger than 65, with 10 million new cases diagnosed every year. The total number of people with dementia is projected to reach 82 million by the year 2030 and 152 million by the year 2050. The total lifetime cost of care for someone with dementia is estimated to be about $340,000. This can put an enormous burden on families, as 41% of dementia caregivers have a combined household income of $50,000 or less. While most associated with Alzheimer's disease, dementia is actually a general term used to describe the severe decline in mental ability, with symptoms that continue to decline regardless of medical treatment. Those suffering from dementia have many problems with their short-term memory. This causes many problems in their daily lives, such as keeping track of their wallet, purse, or keys, paying bills, preparing meals, and remembering appointments. In some cases, people become confused enough to wander from home and get lost. And individuals with dementia often do not understand what is happening to them, nor why. That's why it's incredibly important for these individuals to have the stability, compassion, and support of loved ones. Due to the various types and causes of dementia, more times than not, a team is required to help care and maintain the dementia sufferer's health. As the disease progresses, the caregivers' roles will change. Thankfully, there are many people and organizations in Pennsylvania who dedicate their lives to helping individuals, families, and those suffering from the disease. Caring for a person with dementia is not easy. Life becomes a roller coaster. But it is because of the love and devotion and dedication of these individuals that dementia patients have support for daily activities. Today you'll meet some of these people. They're here today to share their experiences. I'll conclude by saying that no one should have to fight this disease alone. It's important that we honor the commitment that these caregivers provide, and it's also vital that we show those suffering from the disease that they're not alone. I'd like to introduce my friend, my constituent, Ross Schriftman, a resident of Upper Dublin Township. As I mentioned, he is the producer of the movie, My $1 Million Mom, which is only about a half hour. If you have the time to see it, it's a very emotional, very moving picture that describes and depicts Ross's struggle in caring for his mom. Ross?
Thank you, Tom. Thank you for having us here, and thank you for your resolution declaring Dementia Awareness Month here in the Commonwealth of Pennsylvania. My mom was my greatest inspiration in my life. She was my partner in politics, and she did so many wonderful things during her life, whether it was English as a second language, Soviet Jury Committee chair, running for district justice, working for the State Department during World War II as a Spanish translator, being a junior hostess, visiting troops at Walter Reed, helping newly arrived immigrants become citizens of the United States with her instruction on the citizenship. Why I tell you this is that anyone, even somebody that is intellectually curious and active in his or her community, can develop dementia. We started seeing signs in my mom in her late 70s. She was diagnosed when she was 82. She died in 2009. While she was dying, I started writing notes about the life that she lived and the times that we were together. I wrote the book, My $1 Million Mom, and then after the book came out, the book is the actual true story, I started thinking about doing a inspirational drama. And that's how I developed My $1 Million Mom, which we just showed to some of the legislators and their staff and some of the advocates here in the Capitol building this morning. I'm very pleased with the response that we're getting to some of our concerns and issues, because our goal is to raise awareness. So when somebody has a loved one that dies, you're always going to miss them. There's always going to be a hole in your life. Well, what do you do with that hole? And I felt I needed to do something positive. So we have this presentation in a box that we take out to community groups. We show the film, and then we have a discussion about dementia, caregiving, planning for the needs of people that need long-term care. So I'm very pleased to be here, and I'd like to introduce Kevin Jameson from the Dementia Society of America, who has assisted me in my project and in all of our work together to raise awareness. And he's going to speak about a new initiative here in the Commonwealth that will help communities, people living with dementia, and their families. Kevin.
Thank you, Ross. Thank you, Representative Murt. Thank you for being here. Thank you for House Resolution 321, declaring that May is the month that is dedicated to dementia awareness in the Commonwealth of Pennsylvania. I'm a proud Commonwealth resident, and I love that fact. I come to care about the issues of dementia because of my wife. My wife had dementia and passed away in 2014. But in that process, I came to an understanding that people needed to know what dementia is and isn't. And so I wanted to take that opportunity to help others understand that. And so we're doing it nationally, but we're also very active here in the Commonwealth. And I would like to say that dementia awareness, most people don't realize that dementia is not a disease. You say, not a disease? No, it's an umbrella term. And not unlike cancer is an umbrella term for different forms of cancer. So dementia is not a disease in and of itself. It's a representative, it's a manifestation of an underlying pathology. Sometimes that pathology is Alzheimer's disease, but it can also be Lewy body, vascular, frontotemporal, TBI, traumatic brain injury, Creutzfeldt-Jakob disease, Wernicke-Korsakoff disease. All of these types of conditions and diseases, of which there are more than 100, but there's kind of a top 10 that we really look at, can cause dementia. And dementia is the loss of your cognitive abilities, and in particular, the loss of 2 or more activities of daily living. Things like executive function, bathing, dressing, obviously eating. Those are all activities of daily living, and when you lose those, then we start to call that a dementia, because it's a loss of cognition. It doesn't change the person in terms of the fact that they're still a person, and they really are still reachable. They can have creative outlets such as music, art, movement, touch, dance. They can love and be loved. They can still make certain types of decisions, and they certainly can care for themselves in certain types of ways. But generally, dementia is progressive and it's fatal. So it's important to know that dementia itself actually causes death. So if you have no other comorbidity, you don't have a heart attack or you don't have cancer, dementia can still be the cause of your death, because at the end of the day, when your brain is affected so severely, when the pathology has changed so much that because of all your bodily functions are controlled by your brain, that's why when the brain shuts down, ultimately you shut down. And that's the reality that we have to face. But in between our birth and our death, it's really about quality, not quantity. And so as the Dementia Society of America, we believe that it's really quality that counts. And we want to extend our lives to the degree possible, but we also want to live lives that are worth living. To that end, people enter into the arena, so to speak, of dementia at different stages. And some people can just become lost. They may lose the ability to communicate or find words. They don't always have a memory issue. Their behavior can change. They can fall. There can be other signs of dementia other than memory loss alone. But one of the key hallmarks to most dementias is that there's a chance and a risk for people to elope. That's the official term that doctors and medical professionals would call it. Some people call it wandering, but most people aren't actually wandering. They're getting ready to go to work in the middle of the night. They're getting ready to take care of their child when their child is already a full-sized adult. They are wanting to go home or go back to school when they're 80 or 75 or 65. And so their abilities to understand where they are, where they are and who they are can change. So the Dementia Society has created a program. We call it Operation Keep Safe, but it's part of a larger program called My Identification Kit. And I have an example here in my hand. But this My Identification Kit will be free to at-risk individuals in the Commonwealth. We're committed to giving over 1,000 of these away in 2019. And basically, any first responder with a standard smartphone without opening an app, they simply point their camera at this QR code, and it tells the first responder who that person is, provides an image of that person, and a contact. So it really helps. If they don't have a smartphone with them, there's a toll-free number they can call, or they can go on the web. So very easily, first responder or anybody that comes across somebody that's lost and disoriented can help that person get home or get medical care. So I know it from my own life with my wife. When she had dementia, she didn't necessarily have the ability to say my name or necessarily know who I was and how I related to her, but she was somebody that still knew that I loved her and cared about her. And for her, I put an ID on her because I was concerned when we would go out that she would make a break for it. And she had done that many times. But, you know, I always was able to get her back, and we did have a medical ID on her. And so this is one way that the Dementia Society is bringing that to at-risk individuals in the Commonwealth and, quite frankly, throughout the United States. So I just want to thank the opportunity for us being able to talk about that today. I want to thank Ross for doing a wonderful job, almost a Hollywood-style movie here that really depicts care in all the lights that it should be shown in, both good and bad, and also Representative Murt for his commitment to dementia awareness and making, really, it's about people friendliness. It's about knowing the issues that people can face with dementia and then being accepting of them to reduce the stigma and the taboo and the fear. And with that, I'll turn it back over to Ross or Tom.
Thank you to everyone for being here. Anyone have any questions? Members of our media?
We do have kits.
We do have kits that are here. Kevin, I'll let you make
More
reference to that.
information.
Yes.
I mean, press kits.
Yeah, oh, press kits.
Yeah.
Yeah, he meant press kits. So they do have press kits here. If anybody wants a My Identification Kit, just come to see me and we'll make sure you get one. And again, they'll be available from the Dementia Society. Thank you.
Thank you.
Okay, that'll conclude our event. Thank you very much for your support of this issue, and everybody have a great day. Thank you.